Welcome to the Heart Talk, a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast-paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we're joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
Yes, Huma, you are right. At younger people, even the celebrities, they are getting the heart attack even below the age of 40. In fact, 25% of heart attack in India they are occurring during the age less than 40. Now it is not true that the heart problem would occur only after the some age, say the 65 or 70 or like this. So what are the reasons? The reasons is one is the lifestyle. We are having the fast food, some adulterated food, the outside food, and the we are having the sedentary habits like our we are moving away from the exercise. Risk factor like diabetes, even the blood pressure, obesity, smoking, and stress all are increasing during this century. So all they are, even the fit looking person, the celebrities, they also get the heart attack at very younger age. And one more thing is about the genetics. Like famous scientist Inas has told that the coronary artery disease in India occurs in the youth, and they are more prone, at least two times more prone as compared to the Western counterpart, meaning thereby we Indians, we are more prone for the heart attack. And of course, the diabetes, obesity, smoking, and stress, they are contributing to all these things to make the younger people, the youth, to for the heart problems and the heart attack.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
What a question, Huma. I wish you will never develop the heart attack. Huh? You are the heart throbbing of the millions in the India. But I understand you are asking the questions on behalf of the India at large. Yes, the warning signs the person should not ignore during the time of the heart attack. They are the severe chest pain with perspiration, the chest pain which makes the person that there is a heavy weight on the chest, the retrosternal, which might be radiating towards the left arm, which might be radiating towards the jaw or the back. So this is probably the warning sign. And here the person should rush to the family doctor or the consultant physician, must get ECG done, his or her vitals to be examined, and if needed, the TROP I and CKMB and echocardiography. I think this is a something, it is a golden hour. So symptoms which makes the person awake for, that is the chest pain, the shortness of breath, even the fatigue, and probably the perspiration. So these are the four red signals you can consider for. And for such patient must rush to the doctor.
So, talking about that, so what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease?
Yes, Huma, this is very good for our patients as well as the patient caregivers. Like most important daily habits which person should adopt is to eat the balanced diet, which is rich in the fruits, vegetables, whole grains and the lean proteins. Exercise is cornerstone. I would say in Gujarati, 40 પછી તું 40 મિનિટ 40 નહીં તો તું ક્યાંય 40 નહીં. 40 પછી, that is after the age of 40. Why to restrict at 40? You can start at early age also. So after 40, 40 પછી તું 40 મિનિટ 40 નહીં તો તું ક્યાંય 40 નહીં. That is the importance of the exercise. One has to leave tobacco, one has to leave smoking, alcohol also. One has to maintain their weight, their body mass index. They have to monitor their blood pressure. They should take the equal protection for the blood sugar as well as with the lipids. They should consult their doctor, consultant physicians for the screening, because like at younger age also the person can get the heart problems. So to reduce the risk of the heart disease, one can always adopt very good diet, exercise, as well as going away from the smoking. And last but not the least is for the stress reduction. One should adopt the yoga, good listening to the good music, even like family support, the friend support, that is always beneficial.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
Correct. You are right, Huma. I am a strong believer. I am an optimist so far as the lifestyle modification is concerned. The तीसरा बादशाह हम है. उसका मतलब ऐसा है, the lifestyle is the cornerstone. The up to 80% of premature heart disease are preventable. The good diet, as I said, balanced diet, Mediterranean diet or the DASH diet, that can reduce the risk of cardiovascular events. Regular exercise, both aerobic as well as the muscle strengthening, that can decrease the blood pressure, it can decrease the cholesterol, and it can improve the insulin sensitivity. So the diet and physical activity, it can have the influence for the heart in a very good way. I would add one thing. Heart is constantly running for you. My patients, heart is always running for you. So try to run for your heart for at least 30 minutes a day. You run for your heart 30 minutes, heart will always run for you. That is my message.
What about stress? Does stress actually affect the heart, and what are the practical steps that one can take to reduce it?
Yes, stress is the gift of this century. Everyone is under the stress. Probably the fast lifestyle, mobile to some extent. We are having the device which is throughout with us. That is also one of the stress factor for us. So practical steps, what the people can adopt with, is one thing is the yoga. I think yoga or some sort of the muscle mental relaxation techniques like deep breathing. Even you can adopt some of the yoga techniques through Ramdev Baba, Brahma Kumaris or Ravi Shankar Maharaj. So this yoga technique can always help you in reducing the heart rate, in reducing the blood pressure. It can improve overall your health also. So probably the stress can worsen the heart problems, but decreasing the stress will definitely benefit our patients. I will add one thing. The good quality of sleep is always useful. Good quality of sleep means proper time of the sleep. Every day you should have the adequate time for the sleep. At least 7 to 8 hours of the sleep, sound sleep, restorative sleep, and the sleep without your device. आपका device, if you are not with the emergency duty like Dr. Ankur Raval, you can always switch off your phone and you can just relax during your sleep hours. If you are with emergency duty, you have to keep the social device always. But the stress and I think sleep, these two are very contributory, and managing both of them can always benefit our patient at large. I am Dr. Ankur Raval. I am consultant physician and clinical diabetologist based at Khambat, Dr. Ankur Raval Hospital. I am since almost 30 years. I am with the ONGC panel. I am also with the ONGC Medical Interview Board also. I am as a consultant physician with Spandan Multi-Speciality Hospital at Vadodara for more than 15 years, and I also had opportunity to run the diabetic clinic at Kembe Cardiac Care Center for more than 10 years. So I am always with the service with even Suna Hospital Vadodara also at Peklad also for more than 10 years. So I am at service with my patient, and for my patient the carry-on message is work for your heart and heart will always protect you. Thank you.
Well, as we wrap up today's conversation, remember, your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy and it will keep you going strong.